I'm your host, Dr. Jack Braha, and welcome to the Medcastplus show. On the show, we will feature local community professionals who are experts in their respective field and who will share their experiences and wisdom so we, as a community, can learn more about health and wellness. My guest today is Orly Amor. She is the founder of the Health and Wellness Network of Commerce Corporation. Welcome to the show, Orly. Thank you for joining us today.
Thank you for having me.
So tell us a little bit about what you do.
So as a professional, I'm actually a business coach for public speakers, but also a networker, and I own a few companies, so that's really what I do.
So in researching about today's show, I learned that you're involved in a number of companies. Tell us, what is the HWNCC?
The Health and Wellness Network of Commerce is basically a platform for health and wellness professionals, practitioners, service, product providers to network with corporate professionals while providing a sustainable system for both.
So the HWNCC, a lot of letters in a row, okay, little alphabet soup. Tell us what that stands for.
Health Wellness Network of Commerce Corporation.
And so you started this corporation about how long ago?
In 2015.
Okay, so a recent start, a recent event for you. Tell us, why did you get involved and why did you start this?
I went to a networking event of a Chamber of Commerce in Manhattan, and I was very perplexed because most of the health and wellness professionals were on one side of the room and the corporate professionals were on the other side of the room. Nobody was talking to each other. And as a networker and a connector, I thought there was a missed opportunity here. And I went home and I said, we got to build something that will actually connect the two. And it's not that they don't want to do business with each other, they just don't know how, or they don't think about it organically.
Right. So that's true, because as a gastroenterologist, as a physician, I'm in the health part of the room, I guess.
Correct.
And we try to stay away from the corporate folks in the room because that's just the way we were educated for the most part. And as healthcare is evolving, there is a lot of corporate involved. So tell us, what kind of health and wellness experts do you work with?
Well, we invite all health and wellness professionals to the network and we invite the corporate professionals as well, so that they can actually network and basically help each other, connect with each other, and build relationships, because that's really the part of networking. How you're going to do business is by the way you're going to create relationships.
So on this show, we've had physicians, physical therapists, all sorts of healthcare professionals. So you welcome all these folks. How does corporate work in here? How is that relationship important, and what is it that you're doing once they meet?
Many of the health and wellness professionals want to get into corporate because they want to get their services in there or their product, and they're having a hard time reaching the decision makers. And we bring the decision makers basically to them, or we form a way to get into corporate in a more community-wise, because what they don't know what they don't know, and if we don't bring it to them, they won't get educated. So it's all about the education. You got to bring education first. So many health professionals want to sell. There's so many products out there. There's so much variety. Well, how do you think through the clutter? How do you decide? Well, by being educated.
So for our viewers out there today who might be nurses or physical therapists, physicians, healthcare professionals, and they're thinking of taking their brand or their service out to market, this sounds like a forum for them.
Absolutely.
So when they come to you and they come to the HWNCC, tell us of what type of an event you might have, an example of one of the functions that you might host.
Well, the cool part about it is that in 3 years we are now in 6 countries and 10 states. We have 40 chapters around the world.
Wow.
It is amazing, and with no marketing. So that means that there is really a need for this.
Tremendous expansion.
Tremendous, fast, and we're not going to complain, but one of the things that are important is that there are monthly meetings. So they're not like every week like other networking facilitators, but this is a one-time a month where people connect and they have a way to introduce themselves, and there is a structure to the meeting. So there's open networking, you get to introduce yourself, you get to learn. We also bring speakers, whether from health and wellness or corporate, to teach everybody in the room about how they can better themselves or better their business.
And that's very important. We live in a 24/7 economy, a 24/7 healthcare world. Things are evolving rapidly, social media, the news, networking. Has some of your guests or some of your customers, so to speak, How are they evolving with the social media? How do you feel about social media and advertising, Facebook,
LinkedIn.
Instagram, LinkedIn? How are you employing that, or how are you suggesting your folks to get involved?
Well, most of them are solopreneurs or wanting to get into solopreneurship. They come to get educated. So we help them through our network by featuring them on our platforms, on all of our social media platforms. They're members. Being a member, you can also feature yourself, but we feature them too.
So once someone is a member, they come to some of the events, they're expanding their practice, they're expanding their brand. Where do you go from there? You say the word solopreneur. These are entrepreneurs, I'm assuming, that are on their own.
They're on their own, but they don't have any employees yet, or they don't have any overhead yet.
Where can folks who are solopreneurs, which is a great, fabulous word, where else can they go to gain? Do they need to go to college? Do they need to go get a master's in business? Do they need to go to law school? What else, education-wise, are you recommending for folks?
Funny you mentioned two things that I do have. I have a law degree and an MBA, but at the same time, those are not the things that serve us as entrepreneurs. The thing that serves us as entrepreneurs is not to think like an employee. It's not a steady paycheck. There are a variety of things that happen during a month. And we offer expos, health and wellness expos, that they can either come to get educated or exhibit their product or service so that the masses get to see them, not only just at the chapter level.
So you're helping folks sort of break down that maybe imaginary barrier that in order to go into be an entrepreneur or a solopreneur or a healthcarepreneur, whatever it is that they're doing in health and wellness, that imaginary barrier, oh, I must have an MBA or I must have some other advanced training, maybe isn't so. They can expand or they can grow without such formal training.
Absolutely. Not only that, there's no ceiling. There's no more the glass ceiling that we live in corporate. I was in corporate for a very long time, and it didn't serve me because at one point there was nowhere else to go. I mean, I was at the highest level, and then what?
Right. So there are major health and wellness businesses or entrepreneurships out there without a C-suite, without a corporate suite.
Absolutely.
There is one employee, possibly, the owner. And you know, in our field as gastroenterologists, we see that, and we see it expanding in medicine. Tell us some of the specialties or folks that have come to meet with you. What parts of healthcare are they physical therapists? Are there pharmaceutical folks? Tell us some of the examples of the professionals that you are working with.
Definitely. There are pharmacies that join our network. There are chiropractors. There are physical therapists. There are massage therapists. There's a lot of products that are out there for weight loss. So it's many of those. And other products that are helping the circulation in the body, the toxins in the body, and so on and so forth, how to get rid of all of that.
Right, so these resources that you provide are both in person.
Yeah.
You have meetings, you said. Online, where would folks go online to find out more about this?
hwncc.com.
As simple as that.
As simple as that.
And once they're online, what resources are available on the web for them?
Well, the benefits of being a member are there. There's many benefits of being a member. Not only can they be on our newsletter, they can advertise on everything that we do. So and they can come to any chapter around the world or around the country for free when they belong to just one chapter.
So we're here in Brooklyn.
Yes.
Do we have local chapters?
Yes, we do. We have
Where?
3 of them. One in Bay Ridge, one in Flatbush, and one in downtown.
So you're all over Brooklyn.
3 of them, yes.
And we have 2.5 or more million folks living here in Brooklyn. How would you estimate your membership now? Is it growing? How many members do you think you have?
It's growing slowly because the chapters are very newly formed, so that will take a little bit of time. But those who have been around for a while have 100+ members. Yeah.
Fantastic.
I moved to New York from Florida, and it was a culture shock. In many ways, people here are more skeptical about everything. So it doesn't matter what you bring to them, they have to question it, or they will watch you for a little while and see if you're successful at what you do, then they'll engage. Where also people here are more like last-minute decision makers. So it's like, oh yeah, can I still come to this event? And I'm like, okay, we've been only announcing it for over a month.
Well, you know, we see that also in practice with
really?
patients as well.
There you go.
Maybe waiting sometimes to the last minute, but that talks to the New York character. We're a 24/7 city, and,
Right.
and folks can decide at any time
At
in the
any
middle of the
moment.
night, that they want to join you, and that's fabulous. So you accept latecomers who
Absolutely.
sign up at the last
Absolutely.
minute.
Totally.
And the challenges are unique in New York. And are some of your enrollees and some of the folks who you're working with, are they worldwide or are they mostly local? What is their scope of practice in their business?
They're mostly local. There's only a few large corporations that have joined us as corporate members because they believe to bring the health and wellness into their firms. We also do CEO and CFO events to bring the CEOs to one room and then bring the professionals to present to them so that there's more of a collaborative work there.
What we're seeing here is the merging of a healthcare professional or a wellness professional with the corporate world. You're bringing them together at these meetings. They're going out there using some of these resources. What are the barriers that you are seeing in New York in terms of reaching customers? Is New York more of an online? Is it more of a TV? Is it print? What is the most popular way that your folks are communicating their business?
I think that everybody thinks that they can get business online. It's think, and I really would like to say think because it's all relationship based. You do business and you refer business to people you know, like, and trust, not just been meeting them on Facebook. It's a good medium to get your word out there, but it's not a good medium to get clients. I just have not seen it. And I think that everybody's going to that, oh, how many followers do you have on Facebook? But all those followers with the algorithm of Facebook are not really seeing what you're putting out there. So knowing that, you need to know that.
We see that
challenge
challenge
of course,
too in practice of, do we go Facebook? Do we go Instagram? Where is the most reliable source? What is the most reliable source of advertising? And so what would you tell folks, that communication, how do they build that communication out to the public instead of maybe Instagram and Facebook, which we're all addicted to?
Great question, because I believe that public speaking is really the way to go if you're going to get clients. People just need to be educated. You don't have to you don't have to be a part of a big seminar or anything like that. You can just have one thing that you do and give education to 40, 30 people that will be able to refer business to you just because they got good information, good value.